Sophia, are we doing, you're doing everything through slide 4 or slide 5?
1, 2, 3, 4.
And then I'm starting with mental health issues and ROI.
Yep.
Okay.
Okay.
Oh,
well,
quick question. Will people be able to chat? Are people able to chat?
They will be able to ask questions through the Q&A.
Awesome.
function.
Thank you.
Got it.
And you two will be able to chat to all panelists. All right, well, it is 2 o'clock, so let's get started. Welcome everybody to this session. My name is Joe Storch. I'm an associate counsel in the SUNY Office of General Counsel, and what a privilege it is to welcome you all here for this great session. I have been lucky to be on all the sessions so far in this great Spectrum week, and we are so excited to welcome more than 1,600 people from across the US and Canada. We are very excited. I use the pronouns he and him and serve as an associate counsel here at SUNY. Today we're going to talk about supporting the well-being and mental health of our LGBTQIA+ college students. And this is a very important session that will run about 90 minutes from 2 o'clock here on the East Coast to about 3:30. And then we hope that you will join us for the session following that on the intersection of Black Lives Matter and the LGBTQIA+ work. Sessions are being recorded and will be sent out on demand to all registrants following the session. Please note that we are using closed captioning, and you can turn on closed captioning right at the bottom of your Zoom by clicking on the CC button. While we are disappointed that we are unable to be with everyone in person, we are hoping that we can increase participation among registrants in a few ways. First, there is a speaker question and answer option. During the presentation, submit your questions through the Q&A portal, and we will share them with presenters. Panelists may not be able to get to every question during the presentation, but we will try to get to as many as possible. Second, use the hashtag SUNY Spectrum or tag the @SUNY's Got Your Back account on social media over the course of the week to share your thoughts and experiences. We will be retweeting some of them. We will be sharing them on our social media wall, and we look forward to seeing your input. And third, we have a Facebook workspace group. In an effort to create an ongoing dialogue and greater sense of community, we have created a Facebook workspace group for SUNY Spectrum attendees. Use this space to share your thoughts and engage in conversations with colleagues across the US and Canada about what you hear about today and ways to better support students and community members during these times. If you haven't had a chance to join into the workspace group, and need access, please email spectrum@suny.edu and we will be happy to assist. With that, I am pleased to turn it over to our convener and a word about her. Bridget Doyle is one of my great colleagues in the SUNY Student Conduct Institute. I first met her when she was a student activist. She was vice president of our statewide student government. And we have many students who come up to people like me when we do a presentation or when we're doing a SUNY's Got Your Back event. And they say, well, we want to be involved and we want to do something. And Bridget came up and said she wanted to be involved. But Bridget followed it up with action. Again and again and again, organizing programs, thinking through many, many issues that were affecting students, then doing trainings and the like, and really did an incredible job as a student leader. She then went off, got a master's, got another job, and we were so pleased when she decided to come back to SUNY, where she has been doing incredible work. And I think her thinking and leading of this session on the intersection of mental health and what we can do is absolutely perfect. Someone who has brought a tremendous amount of good work here to the State University of New York and to our colleagues across the country. I'm so pleased to turn it over to Bridget Doyle to introduce our speakers. Bridget?
Thank you so much, Joe, for that really lovely introduction. And good afternoon, everyone, and thank you so much for joining us today. As Joe mentioned, my name is Bridget Doyle. My pronouns are she, her, and hers, and I am a staff assistant for the SUNY Student Conduct Institute. I am extremely honored to be convening this important session on supporting the well-being and mental health for LGBTQ+ college students. To start, I want to introduce our presenters. Dr. Sofia Pertuz, pronouns she, her, hers, is the Chief Diversity and Inclusion Officer and Senior Advisor for JED Campus, as well as Maren Greathouse, pronouns she, her, hers, who is the Associate Director for Diversity and Inclusion Education at Tufts University. We really appreciate their time and are lucky to have them with us today to share their expertise. I really invite you all to view their full bios and impressive backgrounds on the Spectrum website. Today's session will be focused on the experiences of queer spectrum students and trans spectrum students as it relates to mental health and well-being, along with recommendations for what we can do to provide support to them on campus. To start by framing the importance of this topic, I want to tell a couple stories from my own career to help us all consider our own impact in this space. Prior to my work at SUNY, as Joe mentioned, I worked as a supervisor at Crisis Text Line, a nationally recognized text-based crisis counseling service, while also working as a residence director at Northeastern University, primarily for first-year students. One night while I was working a shift for Crisis Text Line, I received a texter who seemed really reluctant to speak with me at first. After talking a bit, it was really clear that they were someone in their teens experiencing immense anxiety over something they had not yet told their friends and family. They ended up disclosing to me that they identified as transgender, as well as possibly gay, and that their identity was something they hadn't worked out fully yet, but knew that they weren't the cisgender, heterosexual individual that their family had originally perceived them to be. One of the most interesting moments about this conversation was that this individual kept referencing the start of their college career as the moment in time when they would begin to embrace their own truth, to embrace their own identity. It was clear in that moment that this student was experiencing immense difficulty at home due to keeping their identity hidden from those they care about, and were viewing their moment on a college campus as the moment they could begin to come out and live their truth. As someone who's working on a college campus at the time with first-year students, I was really suddenly struck by realizing my own impact on campus. This person really could have been my student, and this conversation could have happened in my office and have been one of the many ones I had had with students on campus. So what were my students going through and realizing and actualizing on campus that I might not have previously considered? What were they bringing with them to campus that I, as their residence director, was going to end up working with them through? So fast forward 6 months, and a version of the person I talked to over Crisis Text Line did actually appear in my office in the form of a newly matriculated first-year student. They actually came into my office for a student conduct hearing in which I was their hearing officer. And in the process of that conversation, it came to light that they were having difficulty making friends on campus and finding a core group to hang out with, which was ultimately resulting in them making decisions that had landed them in the student conduct process. As an RD, I considered one of the most important, if not the most important aspects of my job was to connect students to campus and help them with the transition. So I pried gently to find out what the disconnect between this student and our community was. The student then said, well, I guess I can tell you this because I can see that you have a pride flag in here. Which definitely gave me a moment of pause because I hadn't even considered how my tiny pride flag that was sitting in a mug on my office desk was going to show as a safe environment to this student. I'd honestly left it in my mug as a leftover souvenir from a recent community pride parade. And because I, as a queer person, am proud of those colors and not ashamed to put them in my office at work. The student then went on, after identifying that, to tell me a very familiar story, that they identified as a lesbian and that no one knew. And in fact, I was one of the first people they told, and they felt like any social group they joined on campus was going to be immediately fraught because of this aspect of themselves that they were afraid to divulge to people around them. Of course, coming out stories or identity actualization stories are ones that we are most familiar with in the world of queer spectrum mental health. And to lend some criticism to my own examples, they don't share the full breadth of what folks in this community experience. While we tend to center the narrative of how this community, in this community around what happens with self-actualization of one's identity, we also leave out how pre-existing mental health conditions, unhealthy relationships, fear of community discrimination, and much more can impact their story after becoming comfortable with their identity as a whole. There are also moments of triumphant joy, of breakthroughs, and of a community that is set on helping one another that also shape this experience. And certainly that means there's much to discuss. These moments in my office and through Crisis Text Line all shaped my why, the reason why I continue to seek out education in this area, as well as professional work and advocacy in this space. Many of you are college administrators, student affairs professionals, or assistant outreach in other ways, both on and off campus settings. I urge you to take a moment to consider your moment of realization of what your impact on this community could be. Was it an interaction with a student, a friend, a family member, someone who personally helped support your own well-being? We have such power to create the environments on our campuses to help students thrive and to give them a space to grow and assist them in bolstering their own journeys. If you haven't experienced your why yet, I sincerely hope this session will begin to be your why. Today's session will help guide you through the research and tools to put the knowledge behind that why, and our panelists bring with them a wealth of information to help better us in this area. Without further ado, I present to you Dr. Sofia Pertuz and Maren Greathouse.
Good afternoon. Thank you so much. And while I share my screen and our PowerPoint, I'd have to, Bridget, I think you have to stop sharing so I can share. I just want to commend Bridget for sharing her, not only her personal story as a student, but as an administrator. And we know that many student affairs professionals, which I was for quite some time, are on what I would call the front lines of working through some transitions with student identity that sometimes some young people don't have that opportunity until they go away to college and have new language and new people that reflect who they are in ways that they probably didn't have exposure to before. So thank you so much, Bridget, for that. I really appreciate it. And that's why we're here. We want to make sure that everyone who is part of a campus community, from student to administrators to faculty, feel that they can be part of the support that young people need, especially queer and trans spectrum students, LGBTQ+. And you're going to hear us use many different words and language and terminology. And I think all of it is in an attempt to just make sure that we're capturing everybody, that we're reflecting everyone's lived experiences. So we're going to share some data. First, we're going to just share a little bit about what we're working on at the JED Foundation. We know that we can't do this alone. There are many partner organizations who we are tapping into to really provide their expertise, their information, their help. But what we would like to do, and this is we're just sharing this, is our Proud and Thriving project is one that we would like to make similar to our equity and mental health framework, who we partnered with the Steve Fund on, that specifically looked at the experiences of students of color on college campuses and what kinds of unique support systems they needed. So we created a set of recommendations, and you can find that online on either of our websites, the JED Foundation or the Steve Fund. So what we hope to do is to work on a set of recommendations and a toolkit to make sure that we give clinicians and scholars at universities information for how best to support. And we have been talking with the Consortium of Higher Education LGBT Resource Professionals. I hope some members are watching this or able to be here. But we know that there are many people who have really great ideas, great programs, and great interventions that they've created on their campuses. So we want to make sure we put that together so that it's easy and easily accessible and able to be referenced by many clinicians and other support systems. So one other thing I want to say is that we are looking at different sources for this. We want to make sure that we capture what are the risk factors, what are the protective factors, what are the things that are exemplary right now. We know that a promising practice on one campus or best practice isn't always going to work on another campus, but if we can at least put them together in one place and make sure that it's backed by whatever literature is out there, whatever data is out there, that we can provide a really good resource for many campus leaders. And this is from 2 years ago, and we know that this is dated. One of the top concerns that college presidents were concerned about was student mental health. And we left this in here, we could have updated it, but lately there's been a few surveys that are asking campus leaders, what are you thinking about? What are you worried about? And we know that campus safety is still an issue, but now we're thinking of health and safety, especially with the pandemic happening and many students are home and doing remote learning. So that brings some new concerns that will contextualize our conversation today a little bit differently, because we know that many campuses have provided safe spaces and affirming spaces for LGBTQ plus students who have found resources and other people that they can talk to about their identity. And we know that that's probably very challenging to do that from home, especially if they're not in a home that is contributing to a protective factor. But we know that this conversation is not done, and many college presidents are also still concerned about the mental health of students. So I'm going to turn it over to my colleague, Maren, who's going to give you some data.
Hi there, everyone. So before we start, I wanted to highlight the Healthy Minds 2018 and 2019 study. In their study, which had 62,000 students, they found that 1/3 of students screened positive for a mental health issue. So what they do is they give a list of different symptoms, and they have students indicate what symptoms they've been experiencing. And they found that 1/3 actually qualified for a clinical screening for mental health issues. What's concerning about this is the return on investment of investing in mental health is unprecedented, and it's really nice to see that schools are starting to look at this from multiple angles, not just from the angle that tugs at our heartstrings, but from a practical angle that can reach folks who might be looking more at the bottom line than they're looking at the well-being of students in particular in their specific sphere. They found that 25% of students exhibiting mental health issues will drop out compared to 10% of mentally healthy peers. So there's a huge return on investment for investing in student mental health. Students with mental health issues are also more likely to stop out compared to their counterparts, meaning to take a semester off or longer before they return to school to complete their degree. We wanted to look at that and just sort of make that note before we got into discussions about queer spectrum students specifically, because these are the issues facing all students regardless of sexual orientation or gender identity. So if we see that 1/3 of students are screening positive for a mental health issue, that's a crisis of public health right then and there. But now we're going to go into talking a little bit about a study that was conducted under my leadership when I worked at the Tyler Clementi Center at Rutgers University. We looked across 5 different data sets. You can switch the slide, Sofia. So we found, so what we did was sort of a interesting story. We applied for multiple grants to do a national campus climate survey and found that we were sort of in a grant making cul-de-sac or grant seeking cul-de-sac, if it were. And so instead of trying to look for funding to do a national study, considering the last one was done in 2010, we decided to seek out what existing data sources we could pull data from. So when we looked at the Cooperative Institutional Research Program at UCLA, we noticed that they had added sexual orientation and gender identity to their demographic questions. So for the first time ever, we were able to extrapolate student data for students that indicated a sexual orientation other than heterosexual and a gender identity other than cisgender, which is just a term to describe people who don't identify on the trans spectrum. We then looked at the National Survey of Student Engagement out of Indiana University in Bloomington. We looked at the CIRU survey, which is the undergraduate student experience at the Research University, which is a pretty big survey that serves all AAU schools, which is the Association of American Universities, and it's one of the elite higher education social groups for high and I should say research intensive institutions. And then finally, we looked at the American College Health Association's National College Health Assessment. And as you can see, all of these added sexual identity and gender identity questions somewhere between 2008 and 2015. So when we conducted our study starting in 2016, it was quite timely. And we can go to the next slide. So we sort of peppered through all of the different surveys looking for questions specific to mental health and weave together a tapestry of a story. Considering we didn't have one instrument that asked all of the questions that we were hoping to ask. So when we looked at the data from the 2016 freshman survey that's done out of UCLA, it asks a question about emotional health for students who are incoming freshmen, so either not yet on campus or just in their first semester, are asked to self-rate their emotional health in comparison to their peers. Now, as you can see from this slide, self-appraisal of emotional health for queer spectrum students is alarmingly concerning compared to heterosexual peers. When you look at the blue indicators across the different identity groups, you see that these are the students that ranked their emotional health either below average or in the lowest 10% of their peer group. So while 13.4% of heterosexual students indicated they were below average or in the lowest 10%, 42%, so over three times the number of queer spectrum students expressed a very low self-appraisal of their emotional health compared to heterosexual peers. And so this is telling for our students who are coming into our campuses. They're clearly coming in with challenges that they're bringing with them from high school. And so we need to start meeting students from the moment they step on campus all the way through graduation. You can click to the next slide. So then we looked at students who were diagnosed with a psychological disorder prior to matriculating for their freshman year. And as you can see, the numbers are really quite different, between 4 and 5 times the number of queer spectrum and trans spectrum students indicated having a psychological disorder diagnosis compared to heterosexual and cisgender peers. So that's concerning in terms of, what our folks in our mental health units are dealing with, because these students are coming onto campus not knowing what mental health resources are available to them, not knowing what their insurance will cover, and sometimes not necessarily feeling comfortable going to mental health resources on campus and preferring to seek resources off campus. Next slide. Then we looked at the American College Health Association's National College Health Assessment. Now, this is a survey that's done across the country and, looks at students across the board. All of these surveys actually are surveys that are done in a census style, open to all students, unless otherwise indicated. And so what's great about this is we're not looking at a convenient sample of queer spectrum students where, typically we would go through listservs and LGBT centers to try to find subjects. These were blanket surveys that were, issued to the entire campus or the entire incoming freshman class. And so we're able to get data that's a little bit more representative. So when we looked at self-injurious behaviors, we found that self-injury was over 3 times the rate in queer spectrum and trans spectrum communities when compared to their heterosexual and cisgender peers. And this is really, really quite concerning that roughly 1/5 of these students have either cut, burned, or otherwise harmed themselves while a college student. Next slide. We also looked at suicidal ideation and we found similar trends, that students had expressed seriously considering suicide in the previous 12 months at rates, 2 to 3 times, 2 to nearly 3 times as high of rates in the queer spectrum and trans spectrum community compared to heterosexual and cisgender students. We also know that students who are on the queer and trans spectrum have a disposition towards exposure to sexual violence, and in a way that heterosexual and cisgender students don't necessarily report. And so these numbers show that, roughly twice the number of forms of sexual violence have occurred among queer spectrum and trans spectrum students, including being touched without consent, or having a sexual assault attempt or completion. Next slide. So we are always looking to see, what are contributing to these outcomes. Oftentimes research talks about the problem, but doesn't talk about the root cause. And so we're going to go through right now a few of the risk factors that contribute to negative mental health outcomes. And then we're going to go through some protective factors. So risk factors contributing to negative outcomes include myriad sources, but we're just going to talk about a few of these today. So stage and identity development is a huge risk factor, particularly for students who are in the questioning phase or in early coming out stages. So students who are really sort of new to the community, like was discussed earlier, may not have a social support network, might not have a trusted adult to speak with, might not have, family that is supportive. And so during this stage of identity development, when your identity is not necessarily solidified and still new and still sort of in a stage of am I not, rates of depression and anxiety are considerably higher, as well as suicidal ideation. Another risk factor is internalized homophobia. We should also say biphobia or transphobia, which is, when we internalize those negative messages that we're taught through our media, our families, our religious groups, and other sort of cultural influencers. Family tension or rejection are particularly significant as a risk factor for mental health outcomes that are negative, which is everything from family members who don't accept your identity to feeling like you can't come out to your family, or a need to conceal identity. And concealing identity in and of itself is stressful, whether or not somebody is out. Concealment in the workplace, concealment in the classroom, concealment in your residence hall can all contribute to negative mental health outcomes, because when anyone feels like they have to keep a secret or they have to hide a part of who they are, that has an internal impact as well as an external impact. Next is incompatibility with faith, and like all of these, it exists on a continuum where some folks come from faith backgrounds that are very affirming, while other folks come from backgrounds that are very restrictive, judgmental, and, see themselves as incompatible with LGBTQ identity. So there's also cultural incongruence with norms and expectations. So in, some communities, you find that being out is considered very, normal and encouraged, where in other communities, there is an expectation that one not disclose their identity so publicly. There are other cultural incongruences with the queer community, particularly mainstream queer culture is disproportionately white, middle class, and male. And so cultural incongruence can sort of span a number of different areas. And so cultural incongruence is a huge risk factor. And then lastly, we've been looking at interpersonal and cultural aspects of homophobia, transphobia, and biphobia, but we're not looking at some of the institutional forms of heterosexism, which is, can be everywhere from institutional hostility, from, colleges and universities that prohibit homosexual behavior, to just a lack of support or lack of resources, that sort of erasure or invisibility. Next slide. Other factors include maladaptive coping strategies. So this can be everything from avoiding one's identity to substance misuse to self-injury to eating disorders, and those coping strategies that students engage in to try to manage their anxiety and depression. Another is proximity to peers engaging in self-harm. When one is around students who are engaging in self-harming behaviors, they're more likely to experience negative mental health outcomes. Experience with harassment, assault, and discrimination. So this, includes verbal and physical harassment, as well as sexual violence and intimate partner violence. And then again, lack of supportive peers. So specific to trans spectrum students, because as we know, trans spectrum students have incredibly different issues on campus than queer spectrum students, and they often get sort of tagged on to the end of the acronym. A huge risk factor for trans spectrum students is the system of genderism on campus, which Brent Bilodeau sort of wrote the book on. So that can range from anything from inaccessibility to gendered facilities, so male and female bathrooms or locker rooms or single sex residence halls, to pressure to present in a gender normative manner. So we call this gender policing. So this, sort of commentary that trans spectrum students face about whether or not they're, quote unquote, passing or presenting in a way that's gender normative and aligned with male masculinity or female femininity. And then gender normative curriculum. And this goes beyond sort of, the sociology classroom. We're talking about gender normative curriculum in women's studies, in biology, in various fields related to the health professions, whether they be medical school, nursing school, physical therapy, and then also, gender normative curriculum or sort of culture in schools like the business school or engineering, where there's a hidden curriculum that students are, told to abide by. For business students, for example, this might mean that they're asked to dress in a certain way for career fairs or for internship interviews. And so, that creates an environment where a student feels isolated and excluded and not, and don't feel a sense of belonging with their peers. So secondly, inaccessibility of academic opportunities and high impact practices is a contributing risk factor in addition to ones previously presented. And so high impact practices are everything from, internship opportunities to study abroad opportunities, to undergraduate research. We find that trans spectrum students have a tendency to not engage in mentoring relationships with undergraduate faculty, so they miss out on some of these opportunities. There are identity document issues that inhibit students from studying abroad. And there is widespread employment discrimination that impacts students seeking out internships, and looking at career development. And again, lack of supportive and informed peers is particularly salient amongst trans spectrum students, because not only do they find a lack of support, but research shows that even amongst queer spectrum students, there's a lack of information and education that leaves trans spectrum students feeling isolated even among queer spectrum peers. And so we're not going to open it up for discussion of others. There are many more than this. These are just some of the additional factors in addition to what I shared earlier.
And we will be talking about protective factors and what some recommendations that we already have can do. But I want to, I wish we were in front of you, and I love in-person interaction, but I want to make sure we pause because we did get a few questions that I think would be really great to answer here. One comment we got was from anonymous attendee: these statistics are devastating, as are the narratives. What are some things we can do to support queer spectrum students? And I completely agree, they are devastating, and we would like to see improvements in these statistics, as we want to make sure that environments where students, we're sending our, I'm a mom, and where we're sending our students that they are going to be affirmed for who they are, and that they don't have to worry about hiding who they are because they're afraid of the people that are there to help with their educational process and making sure they're successful. But some practical questions before that is, people ask, can they have these slides? And we are going to send them to the administrators for the Spectrum conference to make sure that you can have these. You can also go to the Tyler Clementi Center website for Rutgers University. There's a white paper there that Marin had worked on when she was there that has a lot of this information and a lot more data. We're also working on 2 literature reviews, one on gender identity, one on sexual identity, where we're looking at some of these and trying to just dig what is out there. And that's in addition to some of the information that we're hoping to collect on our end at the Judd Foundation. So we're just starting. When we have it ready, we can't wait to share. But for now, some of the questions that I also see that I want to make sure we answer is, are these identities intersecting with race and ethnicity and trauma? And absolutely, when we didn't say the term intersectionality, but we know that there's a lot of cultural competency that doesn't exist when you're trying to figure out what box to put people in. So I think the question here is, what efforts are being done to encourage the diversity of those going into mental health fields? Right now, I think there are many programs that are trying to look at the way that their research is being done and expanding that, but I think that could be one of the things that we look at for sure. What's the pathways to the mental health profession to make sure that it's diverse as possible and that it includes many different and new perspectives. Question here, I'm trying to make sure that it's connected to things from before. What kinds of pushback have the panelists received experience advocating for LGBTQ plus student mental health in higher education, and how did you overcome the challenges? So Marin, I don't know if you want to start. I do have some thoughts on this, what pushback we have received.
I've received, unfortunately, pushback in several different ways. I've received pushback that, in the form of, because I've done things like asked our counseling center to do, not here at Tufts, but at previous institutions, I've asked to, have satellite hours of college counselors in our LGBT center because our students, had hesitancy going to the counseling center on campus and was told, no, there was no, that there wasn't capacity for that. When, there were opportunities that I think went squandered, where their energies were then put elsewhere. I think I've also experienced the downplaying, the sort of suspicion that there aren't as many mental health issues among queer spectrum and trans spectrum students, as their peers, and that, to spend time paying, unique attention to them would be excessive or unnecessary. And so that was a big reason why we did the study we did in 2018, was to prove to naysayers that these issues were very real and very pronounced and, significantly more prevalent in queer and trans spectrum communities than amongst heterosexual and cisgender students. So those are some of the main issues, as well as, working with, HIPAA and trying to provide information while also, ensuring that, we were abiding by federal law, and also, from the standpoint of advisors and supporters, ensuring that we were, not stepping into a space that wasn't ours to step in.
I would say one, not so much pushback, but the idea of, does the data exist? Are these students going to answer a question if you were to ask? And Marin pointed that out, that some of the surveys didn't have data before certain years because the question wasn't asked. So can you count anything that doesn't have a indicator on any survey? So I think just knowing who your population is and starting to count that population and really quantifying and trying to figure out, okay, if the numbers are here, then of course we have to provide resources. And speaking of resources, that's the other pushback. How do you designate staff members who have the knowledge and experience in this area. When you have so many different topics that seem to be funded first. When it comes to, again, back to intersectionality, our racial justice efforts funded first. If you don't outrightly see issues that present themselves. Well, just because you don't have the data immediately doesn't mean it's not an issue. So I think there are ways to use your resources and combine forces and just make sure that you're providing education for the campus on many different topics, including this one. So that's the other pushback. And then someone asked a question, since this is related, about what recommendations do you have for mental health providers working in religiously affiliated institutions where institutional hostility and incompatibility with faith are embedded in the fabric of the campus. And I have, worked through this myself, having worked at a religiously affiliated institution and implementing the first safe zone program or LGBT and ally network of support. And what I found that is the language for creating that program and the mission of the program was embedded right in the language of the faith, which was hope, love, and affirming the full person. So if anyone could argue with those concepts, I think that would be hard to do. But there are ways to find the language within your own documents when you're talking about the idea of who you are and really honoring each person and the dignity that they bring, and the diversity statements on a campus. If most religious institutions have diversity statements, and they truly need to live up to those, and the actions need to match what the statements are and the commitments there. So if anyone does want to talk through that with me and they're having any challenges, please feel free to reach out. We're going to put our contact information at the end. But definitely it is on some campuses challenging, but I think most places are beginning to realize, like, you have to have this conversation. You can't pretend that students are not bringing their whole selves to the campus. And not just students, I mean, our focus is students, but I think faculty, staff, and administrators are part of that community also, and can also be part of the solutions of individual protective factors. So we have more questions that are here, but we're gonna jump back into the presentation and we'll come back to answer the rest. So I appreciate your questions. Please keep them coming and we'll do our best to answer as many of them as possible. So I know it's very doom and gloom to think about all these negativity and then the things that are the factors for causing stress and anxiety and many different negative issues. But there are also individual protective factors that we think could mitigate risk. And some of them are positive identity development internally and socially, including integrating with other held identities. And sometimes those identities may clash depending on what campus you're on and what kind of resources you have. I remember, on one campus, we already had a LGBTQ plus club that was doing some really amazing programming, campus-wide education, but some students that were in that group wanted a queer and trans people of color organization. So there was a clash there where people were not understanding, well, why do you need your own group? Why is that separate? And as Marion mentioned before, sometimes there are some conversations that don't feel as affirming for everyone. So honoring all of it. So that idea of positive identity development and leaving room for all the different kinds of conversations is really important. The other factors are self-esteem, a high self-esteem, self-compassion, outness. Are you able to be your full self and bring your full self to every setting that you're in? That's not always the case, but I think there are many settings where that is the case and many campuses that are very affirming. And exercise. That one's always a positive one for everyone, but that one definitely showed up. There's also group protective factors that are mitigating risk. Community connectedness across multiple spheres, a general sense of belonging on campus, LGBTQ plus safe spaces, affirming spaces, family acceptance, positive interactions with faculty and staff, and making sure that you're having those educational moments on campus where you talk about what language means and what is affirming language and what is language that is homophobic, transphobic. And then connection with other queer and trans folks is really important, and peer-to-peer learning and support, as we know with any identity, is a really important factor on all campuses. Then we have protective factors for mitigating risk specific to trans spectrum students. And you'll see a trend here where we do separate out because there are some unique issues, and there's a question in our Q&A about that. Why are there differences between when we say queer spectrum and trans spectrum? So hopefully we can engage that in a bit. but access to and ease of use of gendered facilities, locker rooms, restrooms, housing. And there are some campuses where there are conversations had about, well, how do we create new ungendered facilities, or that are gender inclusive? And sometimes there are single stall facilities that are located all over campus, and yet we still have a sign on them that has either male or female. Those are the easiest fix if that's something that's possible. It's not always possible on every campus, but that's one of those that I think on many campuses people don't think of right away. And they'll go, oh, that's right, we can just take the sign off and put just restroom on it. So access to faculty, staff, and clinicians that are educated on trans spectrum students' identities and needs on campus. Culturally competent and inclusive curriculum, as Marin mentioned before, and making sure that classroom examples are inclusive of trans identities, and making sure that there are opportunities to engage among students and in ways that are not discriminatory. And that's important for faculty to know how to watch out for things like that. And that goes back to training and education on campus. And finally, protective factors mitigating risk specifically for trans spectrum students as well, is establishing policies to assist trans spectrum students with navigating challenges with documentation for identity, preferred and legal name change. And I know there's many different words that are used for that, and campuses are now beginning to allow a different name on an ID versus legal information that's stored in a system. How you go by, what name you use in the classroom, what name you use day to day on campuses. Designating pronouns and announcing your pronoun when you introduce yourself is another way of visibility, of just affirming that you understand that you should be able to be who you are and announce yourself the way you would like. Making sure that there's an easy way to report it, any harassment and discrimination, if there are issues, that it's easy to find a way to get it resolved in some way on campus. And then when it comes to applying for campus housing, I know right now, everything we're saying is different because of COVID-19. We understand that, but still, that doesn't mean that we don't have our policies in place and that we don't have systems in place to make sure that trans spectrum students know who to go to and how to navigate these systems in a way that's easy and doesn't cause any barriers for navigating day to day.
So we wanted to open up to you all.
Oh, Mary can't hear me.
Oh.
I think you're frozen.
Uh-oh.
I think your picture's frozen, but I can hear you.
Okay. Sorry about that, everyone. My Wi-Fi is very special. So, so we wanted to sort of throw it out to folks in the room. What are some of the issues your queer spectrum students are facing? And what are some of the issues your trans spectrum students are facing? And what do you think are, receiving the most attention, the least attention? And, to pose the question, how do we how do we serve distinct populations equitably? So what are some of the issues? Now, some of you have mentioned it in the Q&A, but we'd love to hear from some folks, take your mute off and share with us.
So if you'd like, hi, it's Elizabeth. If you folks would like to be able to come off of mute to actually participate vocally in the conversation, hit the little raise hand option next to your name, and I'll select folks to be able to join the conversation. Otherwise, folks can input their answers into the Q&A option as well.
And we will come back to the Q&A. There's some really great questions in here that I think, some of them we're not going to be able to answer in this moment because they're very personal to folks, which means that there's some important conversations needing to be had. Someone has a question about 11-year-old and how to find that language. And I know, we're talking about college age students, but clearly these students were 11 once, and we're trying to navigate this early. And like I said before, there's access to information, words, language, and images in the media, images in what we're watching on TV that I didn't have access to when I was 11. So I think if we're not able to have these conversations on our campuses, I think we're welcoming students who may not have had that opportunity. So it's such a great opportunity for us to be able to do that. But let's see if there's any new comments regarding these questions that we have up here.
And I see that Bridget has their hand raised, so I'm going to go ahead and allow them to speak.
Hello, can you hear me?
Yes.
Hi there. So I just have some questions around specifically, we're in COVID-19 and I'm having trouble engaging our LGBT students right now because some of them are on campus, some are working, or some are studying remotely. And knowing that their mental health might be a little, they're pretty bad because they're in unsafe spaces in their homes of their immediate family, being in the closet. Do you have any possible creative ways that we can engage them? Some ways that we can be supportive, especially at this trying time?
I have some ideas. Do you mind if I go first, Sophia?
No, go ahead, go for it.
Okay. There are all kinds of ways that you can support students that are, living in environments that are either unsafe or not affirming in some way, shape, or form. Having student like social hours is a great way to bring students together, a few times a week to talk about different issues. Having online discussion groups, online book clubs, ways to engage the students with their peers is a critical way to help mitigate some of the mental health challenges they're having, because it creates a sense of community, even in a virtual context, that helps these students to feel, as one, a sense of belonging, but two, create a world outside of their, physical home environment. We know a lot of these students have been building communities on Tumblr, for years. And so providing those opportunities is critical. Also having drop-in office hours, via Zoom is a great way to, just be available for students when they want to come in and talk about issues and vent. So that's a great way, but also having, cultural programming, just exposing students to their, to various aspects of queer and trans culture has a huge impact on self-esteem, which is a big protective factor, by teaching students about their history and about the things that make the queer and trans community so magnificent. So those are just a few thoughts of mine. And, I'm stealing a couple of ideas from Hope Freeman, who runs the Queer and Trans Center here at Tufts.
I'm going to lean on some of our partner organizations, and back to someone asking a question about their 11-year-old. There are many organizations that have been doing work around this through K-12 education. PFLAG is an organization that has been very supportive to families and to parents. The Trevor Project has not only a call line, but they have a text line. So sometimes the privacy issue could be if you're on the phone or on video conference, someone could hear you and try to, listen in on what's happening. But I think figuring out how to create a text group around this, whether it's GroupMe or another kind of engagement that isn't verbal, that might be one way to increase privacy. Someone can always find the corner kind of to type things to each other and have some prompting questions that are put out there, and make sure it's secure, that only the people that and have vetted and that your students are part of that group. So there's a lot of really cool questions. So we're gonna keep going because we do have some recommendations that answer some questions that are being asked in the Q&A. And then we'll come back to these questions again, because I think these are the kinds that you can start considering for your campuses. So we're gonna keep going. These are just some of the recommendations that we have thought about based on the data, but what we hope to do through the Proud and Thriving Project is to operationalize these. And if we have recommendations, that we have examples of what that looks like. What are some places that are doing some things that we feel are really helping students and being supportive and are highly rated. Sometimes it's not always easy to evaluate our programs, but some campuses have really done a great job with assessment and figuring out the connection to retention and graduation and overall just belongingness on campus. So some of these include increasing provision of integrated services, including outreach, education, prevention, and counseling services, integrated primary care and behavioral health, ensuring that mental health services and programs are accessible, affordable, and culturally responsive. And I know some of the questions that we got in the Q&A were, so how do you do that? And part of it is training and doing ongoing education. There are many organizations that do provide webinars and are data driven. So that's making sure that there's somebody designated in the counseling center who is paying attention to that and looking at different identities and how you can connect as a team on what are we missing and what can we add. Maren, do you want to cover these? Oh, you're muted.
Why does this always happen to me? So like I was talking about earlier, offering, psychoeducational programming is really helpful for students, offering student spaces to learn about different aspects of the community, are really, really important, but specifically learning outcomes that are critical are challenging stereotypes about queer spectrum and trans spectrum students that these students might hold or people around them might hold, as well as really, contextualizing the problem not being the student, but the systems of homophobia, biphobia, and transphobia that they're navigating. Second learning outcome that's really critical is examining the harm of binary thinking around gender, and even binary thinking around sexuality, to be perfectly honest. Looking at, binarism as a major issue. The third learning outcome critical in psychoeducational programming is finding ways to destigmatize the youth of mental health services, whether they be on campus or off campus. I've worked on campuses that are notoriously not LGBT affirming in mental health counseling services in long ago previous years. And so sometimes you want to be encouraging students to seek care where they're comfortable and where they feel safe. And so if you're in, a bigger area, sometimes you have access to LGBT mental health clinics that use sliding scale or take student insurance. So that's just an example. And then lastly, programming that encourages help-seeking behaviors is really important. Peer mentoring programs are really useful for this. Peer health education programs are great for this. So other recommendations, offering education to parents and families. This is a little tricky because of FERPA, but offering resources on your website can be a really valuable way to get information to parents that their students can share with them. And then offering gatekeeper training on suicide prevention for faculty and staff. As we see, the rates of suicidal ideation are very high amongst this population, or these populations, I should say. And so offering gatekeeper training is really important to just prepare, the folks that aren't typically on the front line, the faculty, upper level administrators, new student affairs professionals, and even RAs on some of the ways to identify, suicidal ideation and get students referred to the appropriate, crisis management teams or mental health professionals on campus.
And one of the things you said, I'm looking at the Q&A while Maren is talking, and somebody made a comment about the idea of the word gatekeeper and that term being one that is probably not that great. So when I was thinking, what other words, and language has power, and maybe resource connector or something else. But you're right. I think we use terms and we don't really think too much about them.
Definitely. Well, and gatekeeper training is a specific training that's offered through the Garrett Lee Smith Foundation. And so that's actually that's why it's capitalized, is that it's like a specific suicide prevention training. But you're right, gatekeeper is a highly contentious and problematic word in many contexts regarding queer and trans spectrum students and people.
And this is our last slide with recommendations, and we ask you, send us any that you think are factors that are really supportive on your campus, things that you're doing. And so one of the questions someone asked is, do you know of any exemplary programs, or is someone really getting it right? Is someone doing programming and support for mental health of LGBTQ plus students in a way that everyone else should really pay attention? So while I talk about this slide, maybe Maren, you can think about what are some that came up as you were doing your research that would be a good model to share. But identifying patterns on your campus related to mental health by utilizing case files to monitor occurrences of injury, admission to detoxification facilities, sexual assault and relationship violence, academic and personal withdrawals, delays in time to graduation, significant drops in course load, unexplained GPA decreases. And maybe there's many others, but just the patterns of behavior. And this can go for any identity. If there's anybody who's showing that they're just not engaging or participating or able to do the work, that's a area of concern. The idea is to make sure that our students are successful. So if there's anything happening, we should be able to outreach and just take care of a human, take care of a person that is seemingly in distress. So back to the gatekeeper training, that's the idea that you would have someone, not just a trained professional as in a clinician, but that anyone on campus should be able to identify some of the signs and look at that. But I do agree that there are very specific differences, and that's why we're doing the Proud and Thriving project, to figure out what is different. What do we need to recommend that might be a little more nuanced for these student populations? So here we'll leave this slide up so you can help us think about what else, what did we miss, what other resources, but we'll go back to the Q&A. But back to the question of exemplary programs or any that are good examples of models that we can look at. Maren, I'm not sure if you have some quickly in mind, but I'll try to think of some also.
I think there are a lot of internal resources, like intra-campus resources that need to be created. We need to be, training our healthcare professionals on how to take a proper history, like health history, and, to assist students with their physical health care in a more appropriate way. We need to be training mental health professionals on LGBTQ specific treatment, not necessarily sending, mental health professionals to a safe zone training, but sending them to trainings where they can get clinical training on treatment of queer and trans spectrum student health issues. Those are two that come to mind. But I think also, doing more with campus research. So many of our campuses don't ask questions related to sexual orientation and gender identity on any of our institutional research surveys. And if we were to be able to do that or add those questions, we'd actually be able to measure the experiences of these populations in a way most campuses currently don't, from the time of admission until graduation. So we don't know, things like recruitment and retention statistics. We don't know how many students are stopping out and dropping out. And those are, not necessarily the most paramount issues to me. The immediate health needs are the most paramount to me. But those are what get the attention of executive administrators, who are looking at the bottom line and looking at ways to try to, ensure that, we're meeting the financial obligations of the institution. And that's just real talk. So those are just a couple of things that come to mind.
And I'll read these out loud in case someone wants to just think about these. But what information is missing from the recommendations we've highlighted? What new resources would you like to see that would help make the case to improve and increase the support, especially in the area of mental health? And if we were to create a digital repository of program curriculum, tools, and resources, would you use it? What kinds of materials would you like to see in there, aside from links to programs or descriptions of programs or some organizations that are supportive and could be helpful in different areas geographically, by state, by area? I know that there's a wealth of information out there and small nonprofits who are doing some really great work. So we'd love to collect those and figure out how to do that. But of course, we're a nonprofit ourselves, so we're trying to make sure that we have the full support of many organizations that are already doing this work. So I'm going to go into our Q&A because there was a really good question here about something we see on our campus is how LGBTQIA+ students, especially trans students, are treated by first responders when there's a mental health wellness check. Officers are not always trained well and may use dead names, incorrect pronouns, etc., as well as policing the students rather than providing care and support. This one's, you know, a really tough one right now because we know that this is something that is driving that idea of defunding police. Are police officers the right people to respond to a wellness check or a mental health issue if they're not properly trained? And part of that training is to recognize that, you know, I was in my previous role, I was a dean of students where I had discussions about if someone's telling you their name is X and that's what they want you to call them, why would it be such a difficult thing to just use that name? And I know that, you know, sometimes we go back and forth about, well, the legal name is what needs to go on legal documents, and that's true, and that's fine. But in the middle of a situation, that's not what is most important. It's the wellness of that person and what they need in that moment. It's not just about the you know, what needs to go on a form. The forms could be correct. It's what is in front of you that you're dealing and handling with. So I don't know if you have any thoughts on that, Maren.
Not that I can think about the moment. I'm sorry, I got a little distracted. I'm reading the question.
I know, I'm reading all of these different, but the idea of first responders or public safety officers, campus police, and others who are tasked with responding to students in distress who they may not know how to handle the situation because they may not have been properly trained. So someone was sharing their own story on their campus that they don't feel that their first responders are properly trained in this area. So what are some things that campuses can do to make sure that at the very least, they know how to respond without escalating the situation?
Definitely reaching out to your campus safety office is a really, easy way to, initiate training around queer and trans student issues. One of the things we've done is, on campuses I've worked on, we've needed to have public safety officers at large scale events. And so training those officers prior to their shift, supervising the drag show or, a queer and trans dance party or something has been a way to try to mitigate some of those. But in terms of first responders, I think it's good to partner with your Title IX office to do joint trainings on, how to respond to students who are victims of bias or sexual violence. It also is, complicated by the reality that, some institutions don't have a campus safety office. They rely on the police within the larger municipal, setting to serve as public safety officers. Some, campus police departments aren't they don't implement a community policing philosophy. And so it's really important from the top down to, talk to your administration about not only, training first responders on these issues, but also training first responders on how to deal with issues with students of color, and right now we're living in a time where looking at evaluating our campus police departments is more salient and relevant than ever. So this might be the time to strike, and propose those types of training initiatives because we have the ear of college presidents and chief student affairs officers in a way we never have had around, law enforcement and public safety for our students.
Okay, another question someone wanted to know, this was from way before. That's such a great point on education in the healthcare world. I advocate that my fellow physical therapists take advantage of SUNY Spectrum's educational content. What recommendations would you make for healthcare and rehab providers?
That's a tough one for me because I'm not in that field. You might, your professional association might have some guiding documents on that. There, is a wealth of information that's available from, the National Association of Nurses, the American Medical Association, the American Psychological Association on different practices, but there's also sort of research that's peppered throughout our databases on our campuses of studies done with particular issues that just hasn't been synthesized or, reviewed in a, systematic review. that you can find some of these strategies in, but it all starts with curriculum, right? In the classroom, you know, our school's doing, you know, curricular reviews of, you know, like syllabi reviews. At Tufts, you know, we have multiple units right now doing syllabi reviews to ensure that there's representation of not only, you know, content that reflects the identities of our students, but brings in scholars, you know, and representing scholars of color, women, queer and trans, academics, you know, and really ensuring that not only our content is representative, but also the, you know, the folks that are writing the articles that our students are being assigned. But unfortunately, it's difficult for me to answer that specifically for health professions because you know, the cultures are so different from occupation to occupation.
But Maren, I really think that your answer was spot on in that there are professional associations guiding all of these different professions. And my area of expertise and knowledge is higher education, right? So there are professional associations who do have guidance on these. So if your association, whether it's physical therapy, nursing, whatever medical profession, or even other professional schools, if they don't have a guiding document around these topics for queer and trans spectrum identities, then the good question to ask the leadership is why not? And ask those good questions and make sure that when you're engaging in professional development through them, that you're asking for additional information, because there are likely many people who either self-identify or have knowledge and expertise in terms of research, so they can bring that to those professions. So that's not an answer exactly, but more of a how do you find the answers that you need when you're looking at it from different angles and different perspectives. So that's I like the idea of the curriculum piece too, that Maren mentioned. If you're in the classroom and you're not talking about this, why not? Why isn't the curriculum broader and bringing in examples so that you are prepared when you're going out to serve all people? So I think that one's an important one. So we'll also give an opportunity. We have about, I think 20 minutes. Is there anyone else who has something they want to say? We'll keep reading through the Q&A to see if there's, some of them are suggestions, and we really thank you for that, because those are ideas that we're going to add as we continue this work. But if there's anybody who wants to speak up and say anything at this time, that would be really welcome, and you can raise your hand. So Bridget, I don't know if you see any raised hands at this point. If not, we'll keep going through the Q&A.
I don't think I see any on my end. Elizabeth?
There are no raised hands right now.
Okay, but we have 23 questions, so we'll go through some of these. Some of them, like I said, they're not exactly questions, but they're suggestions and important and useful websites. One question we got was, I think it's so important to address the potential institutional trauma that LGBTQAI+ survivors may have experienced, and how that impacts folks' willingness to or ability to seek services. Do you all have any recommendations for addressing institutional trauma?
I'm gonna softball this one to you, Sophia.
Yeah, I figured you would. And I think just like with other trauma-informed resources, I think on your campuses, making sure that Title IX offices are connecting closely and communicating closely with your on-campus clinicians is important, because I think they have broader information about trauma-informed practices that they can probably help Title IX offices with, and can help you just think about, what do your documents say? What's your intake process like? What kinds of questions are you asking while you're trying to explore a situation? Are you training all your investigators to ask questions in a way that doesn't cause more harm? So the idea of trauma-informed is not to inflict further trauma. So those are my quick suggestions. It's been a while since I've been a dean of students, but that was one of the things I remember, just making sure that your process is as affirming as possible, but also informative as possible, so that it's not causing more, and efficient as possible. I think when it's dragged out, when there's a lot more steps in the process, I think that causes even more issues for someone just trying to get some resolution on this topic. Another question sort of related, but it's about honorifics and documentation throughout the Title IX process. I recall when I first got to my previous institution, one of the conventions or traditions was to send out conduct letters with Mr. or Miss and the last name. The interesting thing was the campus culture was first names. So for example, even as I had a doctorate, but nobody called me Dr. Pertuz. That was just not part of the culture. People called each other by their first name. So I really loved that about it. So it was very strange that we had this leftover, just, older tradition to call Mr. and Ms. So some of us got together and said, why are we doing that? That's not even part of our culture. So why can't we just use whatever name is designated as a preferred name or first name? And that was a pretty, I wouldn't say easy fix, but it's just changing something in your system that's a templated kind of thing. So we didn't have to worry about Mr. and Ms. and getting it wrong and misnaming someone. So that's something, if you haven't done that for your systems in general, I think that would be a good one to consider. I'm trying to see anything else.
I'll just say while you're looking at those, a huge resource available, because folks have been asking, what resources are there, is the Consortium of Higher Education LGBT Resource Professionals. Their website is lgbtcampus.org. Super easy to remember. But they have guiding documents on serving trans students, on serving queer students of color. They also have they're a membership-based organization with a really robust website or sort of repository of different services and resources that can be provided to queer and trans students. So if you're interested in learning more about those, it's relatively easy to become a member. Your institution may be a member as well, which means that they usually have like 4 slots. So if you have an LGBT resource center on campus, you can contact them to see if they have any openings for you to become part of the institutional membership, or you can, go through your offices or personally secure an individual membership to gain access to those resources.
Someone added a question and we're going to add it to our exploration. How are campuses helping trans students who want to stay non-disclosed but may not have changed their legal documentation? And there are campuses who've been able to get around this. So we'll add this to when we create our recommendations, this question, to make it as easy as possible to find who is doing it and what systems are they using to do that. And I just missed it. There was another question that I saw in here that I thought was really a good one for many folks to consider. This is a statement, but it's also a question. A big issue on our campus is tenured professors in fields like psychology and sociology teaching openly homophobic material. For example, quote, being gay is a reflection of an imbalance in the mind, close quote. So I'll pass this one over for you, Maren, because I know that curricular issues are definitely one that need to be considered if you're trying to create affirming environments for LGBTQ plus students.
Definitely. This is a huge issue across multiple disciplines. The canon is, long-standing and doesn't include queer and trans voices. So it's really important for faculty to interrogate the textbooks they assign. What are those textbooks telling them? And if they're telling them those things, how can you use it as a learning opportunity to teach students about, outdated forms of thinking about gender and sexuality? I think that's a really important piece. But I think, one thing that would be of great service is to do, create, what am I trying to say? Create syllabi review groups within departments and divisions to try to take a look at some of the canon, in one's field. You look at the canon in psychology, in health sciences, and they're, the biologically essentialist ideas about gender are embedded in the text. And so it's really important for faculty to take an active role in interrogating those texts and interrogating that canon. But when they don't, it's really, it takes advocates from outside. So LGBTQ faculty and staff organizations, speaking to your provost's office, speaking to the chair of the department, and empowering students to be vocal in the classroom when they don't agree with the material in front of them, when those students feel safe and comfortable to do so. But we can't discount empowering student voices as well, because sometimes that can be the most effective tool and the most empowering tool for a student.
And someone asked a question that actually hits a nerve for us as we're developing a survey. As a pedagogical point, is it advisable to include such text for the point of showing how thinking has evolved, how it's incorrect? And I say yes. I mean, there's always room to add more and more current information. I think if there is a faculty member who's using old text and old information and data and doesn't update it, I think that's the issue. That's the issue there.
Right.
We put together a survey recently that we're going to be sending to counselors and mental health clinicians. And there's a scale in there. I think, Maren, you remember what the scale is, but it asks questions in a way that's very jarring about the LGBTQ plus identity. And some folks who we had review it said, you can't include those. I mean, those are obviously, they're terrible questions, but they're from an old scale. So it's a tough one because we don't want to take them out, because there are people who have the thought process of what we're trying to get at in the survey. So I don't know if you want to speak to that, Maren, but that was a tough conversation for us. How do you make updates and show, yes, don't erase it, because yes, you need to show that there has been changes and updates now, but they can't stand alone if you're trying to create an environment where people are getting more updated information.
Right. Well, and I think that, queer and trans students are not made of glass. They know these issues exist. They know these frames of thinking exist, and they want to talk about it. They don't want it hidden from them. They don't want to be coddled. They want to talk about these issues. They want to express their frustration. And so the goal as faculty is to create the space to have those conversations and hold the space for those conversations, not to avoid, exposing students to outdated material. But there are some students who will be, inevitably triggered by that material, just like there are students who are triggered by material of all different kinds. And so it's that delicate balance of how do you introduce the material in a way that causes the least amount of harm, and how do you prepare students for conversations that may, bring up issues for them. So not only holding space in the classroom, but holding space after class, holding office hours to talk about material, putting a disclaimer on your syllabus. If you're ever uncomfortable with the material being discussed, you can always reach out and schedule a time to speak with a professor to, just vent your frustrations or concerns or talk about, the way it's making you feel. I think one of the biggest challenges with faculty in the United States is that, climate surveys show us that they don't feel responsible for students' emotional health. They don't feel like it's their place. But a student's intellectual and emotional health are bound together because these are embodied experiences. You can't talk about immigration without talking about real people that are attached to that discussion. We tend to intellectualize things in a way that divorces it from a human lived experience. But we need to be looking at these issues from the embodied lens.
I completely agree. And one last question that we won't have an answer for, but we have it's another one of those, it's good to hear it out loud, right? So can university and college administrations hold faculty accountable when they publish anti-trans articles and essays? What are some options here? And I know that recent journal revoked an article, I think it was Lawrence Mead, and that's not an academic institution, a school or university, but I think it depends on what the research is and what the policies are on campus, because at the end of the day, you still have academic freedom. So I think that's a good question to ask your own campus, especially when you're in the position to have these really tough conversations with students. How do you explain to them what the campus policies around free speech are and academic freedom? So an answer, but not an answer. I think it depends on each of your campuses. So any last thoughts?
Right. Oh, I just want to say that, you know, when we look at faculty freedoms, academic freedom is afforded to faculty in the publishing of their scholarship, but not in the classroom. So that's a good way to draw a line, is to say, you have the freedom to publish whatever you want to, but you don't have the freedom to spout your ideas into the classroom if they're incompatible with discrimination and harassment policies at your institution. Your freedom, you know, your academic freedom is not protected in that context. And so it's important to just be thoughtful about those distinctions, you know, when talking about, because faculty think that they have the freedom to say and do whatever they want to sometimes. They're like, it's my academic freedom. Technically, you have academic freedom. Technically, you have freedom of speech. But higher education is a limited public forum for free speech. So speech has to be educational in nature. And academic freedom extends specifically to scholarship, but not necessarily to in-classroom or on-campus behavior. I did a paper on this, specifically because I was frustrated by that exact same issue.
Well, I want to take a moment to thank our presenters, Dr. Sofia Pertuz and Maren Greathouse, for being with us today and for this incredibly informative and in-depth presentation, and for all the participation from the audience as well. The questions and suggestions that were brought in were really awesome as we were scrolling through, and made this, I think, a really interactive experience. So we really appreciate your time and your input. We are going to wrap up this session at this time, but our next session is convening at 4 p.m. and that will be our last Spectrum session for the day. So thank you everyone so much for joining us, and hope you have a great rest of your day.
Are we logging off or are we staying on?
So I'm gonna hop on to open up the 3:30 or the 4 o'clock, which may kick everyone off of this one. But thank you both so much, and thanks, Bridget.
Yes.
Thank you. Bye, everybody.
Thank you. Bye, everyone.
Hello.